Good afternoon, everyone. My name is Angela DeRolf, and I'm your Perry County Health Commissioner working at the Perry County Health Department. And I wanted to share with you some data and talk to you a little bit about testing for COVID-19. So, as of right now, Perry County still has no confirmed cases of COVID-19. However, today the state released some updated data that I wanted to share with you. Across Ohio, there has been 564 confirmed COVID-19 cases. The age ranges from less than 1 year of age to 95 years of age, and it's been affected or reported in 49 counties throughout Ohio. There have been 145 hospitalizations, so that's been 25% of the cases have been hospitalized, and we have seen 8 deaths in Ohio. 62 people have been placed in ICU, so that's 11%. And then 25 of those patients have been residents of long-term care facilities. 16.1% of the total amount were healthcare workers. So I wanted to share that data with you. And again, at this time, Perry County has 0 confirmed cases. So due to the low supply of available tests, CDC, or the Centers for Disease Control, recommends that physicians should first assess patients for symptoms suggestive for COVID-19, so your cough, your fever, and your shortness of breath. Then they prioritize testing for those most severely ill or at highest risk for complications. So as you can see, here are some of the priorities. So priorities include hospitalized patients who have signs and symptoms that are compatible with COVID-19, symptomatic individuals such as older adults or individuals with chronic medical conditions, so maybe diabetes, lung, kidney, etc., or who are immunocompromised. Healthcare personnel who within 14 days of symptoms onset had close contact with a suspect or lab-confirmed COVID-19 case. So those are the folks that are being tested right now. Those are the priority tiers. So folks that are mildly ill, they have been encouraged to stay home. What they've been told to do is to self-isolate. You need to contact your healthcare provider by phone for guidance and clinical management if you feel ill or show the symptoms of COVID-19. Patients who have severe symptoms, such as difficulty breathing, need to call their healthcare professional immediately to get guidance. Older patients or individuals who have underlying health conditions should contact their doctor right away. Even if they have the mild illness, you still want to call your doctor for guidance. So those who are been concerned about testing, you need to know that testing does not change the treatment. And the question has been asked, are Perry County residents being treated or tested, or do they have access to testing? And the answer is yes, they do. However, it's only required that the local health departments receive notification of a positive lab-confirmed test. So when we say there are no positive cases, it's because we have not received confirmation of a positive lab-confirmed test. Therefore, we don't always know how many people in our community have been tested for COVID-19. All that I can share with you is that we have no positive lab-confirmed tests of COVID-19. But I also want to share that if you haven't been tested or you're concerned about not being able to get tested, that testing does not change the treatment. If you feel ill, act as if you have COVID-19. Stay home and take care of yourself. Isolate yourself from others in the home. You need to rest and drink plenty of fluids and take any medications like Tylenol to relieve symptoms. Do what your healthcare provider prescribes for you to do as you are staying home. And again, if you have shortness of breath or something more serious, call your doctor right away, especially if your symptoms change throughout the course of your illness. Again, how can you protect yourself? These are the same ways I've been telling you guys to protect yourself on every video that I've done. Stay at home if you are sick, and stay away from other sick family members in your household if you can avoid it. Get adequate sleep and eat well-balanced meals. Wash your hands often. Wash them with hot soapy water for more than 20 seconds. Make sure if you're coughing and sneezing, you cover your mouth with a tissue, throw it away, and then wash your hands. Avoid touching your face. I know that can be difficult, but please try to avoid touching your eyes, nose, and mouth. Clean and disinfect high-touch surface areas. And I can't stress this enough, if you are feeling sick, call your healthcare provider before going to the doctor. Also, be sure that you are seeking out credible information. Continue to watch our Facebook page, go to coronavirus.ohio.gov, or continue to call the ODH hotline, which I have shared numerous times in other videos. So together, if we can stay home and protect each other and follow these healthy habits, we can help protect one another. So thank you.